The Institute of Muslim Mental Health provides a platform for Muslim mental health professionals to come together to be able to work, learn from each other.
So if we can kind of create this safe zone, this safe space for people to go to, I think that would encourage people to seek out mental health. And if we can encourage our leadership to take courses on a regular basis.
That the stigma that's out there as we're trying to incorporate mental health, because a lot of times there's been a school of thought almost that makes it seem like, well, you can't get depressed because that's just not, you don't have faith or whatever. And so this idea that mental health is connected to a lack of faith has been a huge issue within our Muslim community, which is something that we need to overcome, essentially.
But if we can provide patients and the leadership with the right tools, then we can build anything.
I think some of the most significant challenges in working with the Muslim community I experienced early on, especially when I first started off after licensure as a clinician, very eager and excited to get out there and serve the community, is really a network of individuals and connections and colleagues to be able to work with.
There's a lot of emotional needs in trying to distance themselves and having the parents, pulling them and they're trying and working through that for over the years causes a lot of emotional stress, and it comes out sometimes in some negative ways.
The idea that our religious scholars or religious leaders need to themselves understand mental health because of the stigma that's been associated with mental health, or because of just in general how Muslims go to, or who they go to when they want to solve their problems, they'll go to the religious leader, whether we like it or not. That's who they're going to go to, right? Because they feel that religious leader will be able to solve their problems.
I think it's really important, particularly for doctoral students, to find a good match, especially in research, and finding Muslim mental health care mentor is priceless.
Ideally, we don't want to be in a situation where we're chasing after illnesses. We want to be in a position that we prevent illness from occurring in the first place, or at least are there when we see the first signs of illness, or we're there when we see that people are not doing well, and we educate them. And education is so important.
Brought together academics, researchers, lecturers, professors of colleges and universities, and it also brought together clergy, community workers, and all of that, all together in one place to be able to really up the level of conversation and sophistication in which we approach these discussions and topics and in Muslim mental health.
And just being a part of the conferences, just so you can network and hear from those who are in the field, or hear from those who are in the mental health field, and you can ask your questions and you may be able to give them insight.
This is something, again, a fruit. The Work in Progress group is one of the fruits of the Institute, right? I think it's one of the things that has brought us together in conversation of like-minded individuals interested in Muslim mental health.
We don't have the research behind it until really the Institute has come along. I mean, a lot of times when I do presentations, I'm always drawing on the research that is available, top papers that I've written and so on and so forth. The Institute has been instrumental in getting me the different stats that are out there, or the research that I can use in order to actually speak to it to others. But of course, it's still nothing. It's still, compared to the vast volumes of stuff on other communities, other minority communities even have way more stuff than we do. But compared to that, comparatively, we have nothing, literally nothing. And that's why it's so important to support these types of institutions to understand the effects of mental health on our community, the positive and negative, in order to be able to move our community forward. That's the bottom line, right? Like, we want to move our community forward based on evidence-based research.